Hey everyone, welcome back to our channel. In today's video, we're diving into an important topic, part 2 of our discussion on POCD, or pedophilic obsessive compulsive disorder. If you missed part 1, make sure to check it out for a good understanding. Now let's talk about the help available for sufferers of POCD. It's completely normal to feel frightened about seeking help for mental health issues, especially when it comes to something as stigmatized as POCD. However, it's crucial to understand that POCD is a form of OCD and can be treated similarly. Today, we'll explore the available help, mainly through cognitive behavioural therapy, or CBT. Cognitions, that is, thoughts, are central to CBT. They influence how we may feel and therefore what we do in response. CBT helps people challenge distorted thinking styles, not by replacing them with positive thoughts, but by offering a more balanced view that is realistic and objective. Cognitive approaches play a significant role in treating POCD because we can learn to recognize and challenge unhelpful beliefs that relate to our fears. For example, there is a thinking style called magnifying and minimizing. This is when we amplify unhelpful worries and play down anything that might be rational. Like when one of my clients spent an enjoyable weekend with his partner and niece without harming her, but his mind dismissed this fact and magnified the intrusive thought, well, you would have done something if you were alone with her. Another thinking style is black and white thinking, where we think in extreme terms. For example, because I had that intrusive thought, I am a paedophile. CBT helps by offering a more balanced and realistic perspective. Moving on to behavioural approaches. CBT applies exposure and response prevention, or ERP. ERP will teach you how to combat POCD's tyranny, and it will never ask you to do anything that infringes on your values, like harming a child. However, this does not mean it will be easy. You will be tested and asked to experience unpleasant thoughts, feelings, and situations. But you're already doing this at the hands of POCD. The difference is that when you suffer because of ERP, you are learning something. You're training yourself to resist compulsions and confront anxieties in a paced manner. You will move in a progressive direction as you gradually begin to experience less anxiety and start to feel free of POCD's wretched hold on your life. You can start to do the things you used to do without being misjudged and punished by POCD. Mindfulness is a crucial aspect of CBT. It teaches us to be consciously present in our thoughts and emotions. By observing without judgment, mindfulness helps confront and accept intrusive thoughts. It allows us to respond in ways that may not feel right initially, fostering a non-judgmental and accepting mindset. Now, a common concern is when people ask, is CBT telling me to accept something against my beliefs? The answer is no. CBT encourages accepting of anxiety-provoking thoughts, emphasizing that acknowledging these worries reflects strong moral values and a desire to avoid harm. Understanding why POCD occurs is crucial. It can emerge in various ways, but recognizing it as a form of OCD is invaluable. Even so, you might be afraid to have CBT treatment, especially ERP, which asks you to confront thoughts that scare and sicken. But what is the alternative? You've tried avoidance and rituals, and yet here you are. POCD wants to control you. It wants you to submit to its will, to exhaust you by having you worry about all aspects of your life. What you do, where you go, who you interact with, how you interact with children, what you watch and buy. POCD wants all of you. Yes, even your identity is at stake. POCD wants you to lose everything by learning that you are the thing that you fear the most, a paedophile. But it's essential you realize what stands in the way becomes the way, as Marcus Aurelius put it. That is, the fear you have must be confronted to combat POCD's control over your life. You can realize that you're not an awful person who should be locked away, but that you're suffering with a form of OCD and you can beat it. This is one of the traps that POCD sets for you. The need to prove to yourself that you are not the thing you fear the most. You will likely have searched online, watched some shows and talked to people about pedophiles. Essentially, you've been looking for information because you must convince yourself that you aren't sexually attracted to children. And this is maybe why you're here with me now. You do all this because you want assurance, to be 100% certain that you're not a pedophile. This sends you into the obsessive compulsive cycle of POCD. You are searching for the gold at the end of the rainbow, but there is no such proof to be found for you or me, because we cannot prove a negative. So instead of chasing certainty, you can foster confidence, faith, and trust in your core self. This is nigh impossible when consumed by OCD. But by being open to uncertainty, you can live in ways that do not strengthen POCD's stranglehold. Trying to prove a negative is also accompanied by another less sophisticated trap of OCD, the belief that if you're capable of harming a child, then you will. Capability, however, would not stand up in court. If it did, we'd all be in jail for all sorts of things. It's therefore important to separate possibility from probability. Just because I can do something doesn't mean I will. So if you're having horrible, intrusive thoughts about children right now, then remember that this is your current experience right now, and that is all it is. To anyone struggling with POCD, it's vital to realize that you are not alone. Having intrusive thoughts doesn't make you a bad person. POCD is a common mental health condition that can be effectively treated. Don't suffer alone needlessly. Access the antidote by seeking help. So I hope you're finding this video useful. Do subscribe if you are to let me know. It really helps me out. Remember, seeking help is brave and an important step, and you deserve support. Thanks for tuning in, and I'll catch you in the next video.